fever is a body's natural way of ridding an infection. When my wife was pregnant and delivered our son a few months ago, they pushed her to take acetaminophen for a low-grade fever. She said no.
I apologize. We had some technical difficulties. If you were on the stream a second ago, had to get back live. We're still picking right back where we left up at the president's news conference. And nothing really changed from our last encounter, but thank y'all for tapping in for the stream. Regardless of it, this is the press conference on autism. Wait for everybody to trickle back in, slowly but surely. The internet is just...
Make it available. Hundreds of thousands of kids, in my opinion, will benefit. One study found that with kids with autism and chronic folate deficiency, 2/3 of kids with autism symptoms had improvement, and some marked improvement. Mr. President, you told us to do what's medically right, to go bold, and not worry about the corporations and the lobbyists, so that's what we're here doing today. Thank you, Mr. President.
Good, thank you. Thanks, Marty. I think we'll appreciate the passion in the president's voice. We've been hearing that since the inauguration. In fact, even before the inauguration, the president was upset about what he spoke to today. And so together with Secretary Kennedy, who's made it his life's work to address some of these challenges with autism, they challenged us. In fact, they were harsher than that. They wanted no silos to break down what the NIH would do, what the FDA would do, what CMS would do. They insisted that the physician leaders bust through the clutter because their agencies had the power if we didn't do what every other prior administration had done, which is to let people function within their siloed environments. Because of that, in historic fashion and a very accelerated manner, we have a response today to the autism crisis. It is the first of several chapters, but this is breaking news. You've heard some of it. The response to the autism crisis is going to continue to come to you under Secretary Kennedy's leadership, and the president wouldn't have it any other way, as you've heard. The FDA, based on NIH research, is approving prescription leucovorin for treatment of autistic children. Now, if you're following the script, there should be two questions that you have, two questions that should come to your mind. The first is, how will patients and parents get access to the treatment? I'll tell you how. Over half of American children are covered by Medicaid and CHIP, government health insurance, over half. Therefore, because they're covered in Medicaid and CHIP, upon this label change by Marty, state Medicaid programs in partnership with CMS will cover prescription leucovorin around the country. It's yours, but you have to go to a doctor to get a prescription because they know your child, they know you, and they know the medication. States will also have tools to monitor its use and ensure appropriate utilization. That's important for a bunch of reasons because we want the right kids getting the right prescription medications. We believe private insurance companies will rapidly follow our lead if they have not already done so. And again, to make sure that this is safe and effective treatment, you need a physician to prescribe the medication because it's on prescription. Second big question, how are we going to collect clinical data to answer the big questions that the president's asking and the secretary insists that we offer? CMS is also issuing guidance to convene states and existing research networks to support NIH and FDA in their research efforts of prescription leucovorin, while also maintaining the privacy of all patients, all health information of our beneficiaries. Collecting real-world data, which is what many of you have been asking us to do in the community, is fast, it is life-saving, and we'll get answers based on what happens over the next few months with this approach. The aggressive approach, and it is aggressive, demanded by the president and by the secretary, have already identified risk factors and opened the door for the first FDA-recognized treatment pathway for autism. It is the first of its kind, and it wouldn't have happened without the leadership of the president and the secretary. The five-fold increased prevalence of autism over the past 25 years demands a rapid response. The average clinician, researcher, we spoke to many, thought it would take 5 years to get this data. Parents are unwilling to wait 5 years. The president is unwilling to wait 5 years for these results. So the president and the secretary are acting today with this tri-agency move. The administration's bold actions investing in groundbreaking research follow the science, they restore trust, which has been lacking, and they will change the trajectory for millions of American families. Mr. President, God bless you for being brave. So let me introduce Dr. Fink, who's acting administrator, and after Dr. Fink, we've got some wonderful women, Jackie and Amanda.
Got a couple more doctors here,
You
but
can make some comments about this historic day.
between that, again, thank y'all for tapping in. We did have a slight interruption here. I'm not going to overtalk the First Lady speaking on the dais.
You today.
Let her get her stuff off.
Christian and Mom, I'm here today to talk about what this announcement means for the millions of moms and dads who are faced with the choice of whether to take acetaminophen during pregnancy. It's hard to hear information that challenges the status quo. We are sharing this information not to confuse, but to empower parents to make the best choices when taking medications during pregnancy. We are all concerned about the rising rates of neurodevelopmental disorders, including autism. President Trump and Secretary Kennedy are dedicated to radical transparency so that patients have the best, most up-to-date information. We are also sharing this information with our nation's doctors, and we encourage you, as always, to consult with your doctor to make the best decision for you. All too often, it's easy to think that medicines we buy without a prescription pose little to no risk for the mom or the baby. As you heard today, pregnant women who need high fever or pain reduction during pregnancy should take the lowest effective dose of acetaminophen for the shortest possible duration. Most women will not meet these indications during their pregnancies. I am encouraged by these developments today because it is another.
Now, I know some people may be saying BS in the chat. I'm actually going to flip over after this to a research at Mount Sinai Medical Center that found the prenatal exposure to Tylenol may increase the risk of neurodevelopment disorders, including autism, spectrum disorder, ADHD, attention deficit hyperactive disorder in children. The study was done and released in August, so it's still fairly new, but I'm gonna get back to it. We'll get to it next though.
This is an historic day, and I'm thankful to be here. I have a son who's 5 who is profoundly autistic, and you've probably heard if you've met one autistic child, you've met one autistic child. It's a spectrum, which I don't think the spectrum is helpful, but that's another conversation. He is an amazing little boy, a blessing from God. He's marvelous. He can count to 1,000. He knows all of his letters and the sounds they make and a word for each one. But he also has a lot of obstacles. He is nonverbal. He can say those numbers and letters, but there's no communication. Unless you've lived with profound autism, you have no idea. You have no idea. He, like you said, he will get frustrated because he can't speak. It's not even that he can't speak. Sometimes he just doesn't understand what I'm saying. He understands the word no, but he doesn't understand the why behind the no. And that's a huge part of discipline. That's the discipline. So it's very hard to discipline a child with autism, so you have these behaviors. And it's a very hopeless feeling. It's very isolating being a parent with a profound autistic child. Even just taking them over to your friend's house is something we just don't do because, again, they're going to be met with no, 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 and no understanding of why. And then there's a meltdown. And then you're in a situation where you're just helpless and you're just trying to protect your kid. So it's just better not to do it. You learn your limits, and it's been really hard. This is amazing that we're here today. And no one has been able to point to anything to say this is what caused it. And you can't point to that and say it didn't cause it. I have no idea. I am completely open. I'm not blaming anything, but I'm open to the discussion and the fact that there's work being done to find answers. I'm very grateful. I was already excited to vote for Mr. Trump anyway, as president. But when we got word of RFK doing his work, I was ecstatic. I could not wait for this work to be done, that somebody would try to find us some answers. I'm just very grateful. I pray for my son every day and hope that he can get the help that he needs. And just thank you. Thank you very much.
Thank you.
My name's Jackie. I'm also extremely grateful for the opportunity to be here
Hey, John.
and share my son's story. My son is Eddie. He's 11. He's on the opposite end of the spectrum from what Amanda just explained. He's considered high functioning. He was not always high functioning. He was nonverbal till the age 4. We've had quite a hard time to get to the place where we are today. I am just so grateful to President Trump and the entire administration for finally listening to moms who have been crying out for help, for answers for years. I've met so many other moms with children on the spectrum in the 9 years since my son's diagnosis, and they all have very similar stories, and they've all just wanted somebody to listen, to not ridicule them or look at them like they were the crazy people. It's hard when you don't have doctors that take the time to really listen and find out when the change happened and what change happened. And it's just, I've been praying for this day for 9 years, and I'm so thankful to God for bringing the administration into our lives. And I'm speechless. This day is a day I never thought would happen. I thought that we would never have an administration that was courageous enough to look into things that no prior administration had. So I'm just here to express my gratitude, and I am looking forward to what comes from this, and hopefully we just get more answers. So thank you.
Thank you very much. So I just want to say acetaminophen is basically Tylenol, essentially, because I noticed that term is used throughout this conference. So it's essentially Tylenol. And I just recommend strongly that you don't use Tylenol unless it's absolutely necessary. I understand it's maybe 10% of.
I'm not platforming the jump. I have my rebuttal after this.
Perhaps be forced to use it, and that would mean you just can't tough it out. No matter what you do, you can't tough it out. So that's up to you and your doctor. But there's a very strong recommendation, maybe stronger from me than from the group, because they're waiting for certain studies. I just want to say, I want to say it like it is. Don't take Tylenol. Don't take it. If you just can't.
Oh, Daniel, there it
fight
is.
Like hell not to take it. There may be a point where you have to, and that you have to work out with yourself. So don't take Tylenol. Other things that we recommend, or certainly I do anyway, is, and it's so important to me to see the doctor 4 times or 5 times for a vaccine. Don't let them pump your baby up with the largest pile of stuff you've ever seen in your life going into the delicate little body of a baby. Even if it's 2 years, 3 years, 4 years, you just break it up into, I would say 5, but let's say 4 visits to the doctor instead of 1. And certain things I think you should do. We've already taken out and are in the process of taking out mercury and aluminum now. You know what mercury is. You know what aluminum is. Who the hell wants that pumped into a body? And there were rumors about both of them for a long time. But we're having them taken out. We're having them taken out of the vaccines. Hepatitis B, again, that's sexually transmitted. And we think you should wait. I think you should wait till 12. You know,
that's crazy.
Statements from me. I'm not making them from these doctors, because when they talk about, different results, different studies, I talk about a lot of.
That's crazy.
They have that too. They have that too a lot. But I recommend the hepatitis B. Take it at 12. Sexually transmitted. You don't have to give it to the baby when the baby's 2 years old, and there are a lot of theories on that, but not when they're 12. Doesn't seem to be a problem at all. The MMR and the chickenpox. Chickenpox has already been broken out. It's a singular shot, but the MMR is not. And I've heard for years that there's a problem with it. But they say that there's no problem if you do each shot separately, not put together. So an MMR, go out and do it separately. Don't take Tylenol. Don't give Tylenol to the baby after the baby's born, every time the baby gets a shot, the baby gets a shot, they say, here, take a cup of Tylenol. I've heard that for years. Take Tylenol. Don't take Tylenol. Don't have your baby take Tylenol. Now, Tylenol is fine for people that aren't pregnant, that aren't in the situation that we're talking about. One very specific
Okay. He ain't clarified that earlier.
If
Only
you're
for
pregnant,
mothers
don't take Tylenol.
and kids.
When you have your baby, don't give your baby Tylenol at all.
Your stock gonna plunge
Unless
today,
it's
bitch.
absolutely necessary. Don't do it. Break up your visits to the doctors. Break them up. Do it in 5 if you can. Now, it's inconvenient. It's inconvenient. Oh, you got to have to go back another year later. You're going to go back each year for 4 years, 5 years, 3 years. Just break
Wife
it
just
up.
got home. I'll be
Break it
back,
up.
y'all.
Because it's too much liquid. Too many different things are going into that baby at too big a number. The size of this thing, when you look at it, it's like 80 different vaccines and beyond vaccines, and 80. Then you give that to a little kid. I mean, I can tell you that I had a woman who worked for me, a beautiful, wonderful woman, worked in Trump Tower, and she had the most perfect child. Beautiful, just perfect. And I remember this little blonde-haired boy running around the lobby of Trump Tower, so healthy and so vibrant. And I said, that's great. One day I came in and she was crying her eyes out behind the counter. She worked at the front desk. She was crying her eyes out. I've never, as much as I've ever seen anyone distraught, she was. Boy, you know him, sir. You've seen him grow up. He was so beautiful. And I took him for a vaccine, sir. And he developed this unbelievable, I think she said 107, 108. You know, it goes well beyond when this happens. It goes up to 106, 107, 108. You know, we hear 105 and you're in trouble, but it just goes up to a level that you never hear about, but it goes up very high. And it's fried. They get fried. She said, I took him, he developed an unbelievable temperature. And I've lost him, sir. He's gone. And then I saw the boy. It was so tragic to see. That was the following day. That was the following day after the vaccine. And I've seen it 2 other times, and I think 3 other times, but 2 other times, where they go to the doctor and they get the vaccine, they get the shot. The kid is, badly hurt. Let's be nice, badly hurt. And just do it. Break it up into 5. Break it up into 4. Break it up into 3 if you have to. But go to the doctor 4 times instead of once, or 5 times instead of once. And for some reason, they insist that you put it all into the body, and maybe that's the drug companies that make more money. You're putting it into the baby's body. It can only help. It can only help. And the other things I told you about, just the word tough it out. You know, it's easy for me to say tough it out, but